Good evening, class. This is Ron. As part of our presentation for exposure therapy, my group mates Christine, Lisa, Maria Escobar, and myself thought of a way to engage the class to understanding what exactly exposure therapy is and for which clientele it's beneficial for. So we thought we'd do this really quick video, exposure therapy in less than 15 minutes, just to touch upon the main points of exposure therapy. We'll talk about its benefits, its applicability, and overall what clients can expect when we refer them to a cognitive behavioral therapist to engage them in sessions that are meant to treat their fears, anxieties, phobias, things of that nature. So before we start, it's important to understand what exposure therapy is exactly. So fear is something very real and common to us all. It's a normal response. It can be based on past trauma or unwanted experiences, but it becomes pathological when we become so afraid of certain situations or conditions that pose no threat to us. Within all of us, we have the fight or flight response. And this is ingrained in humanity and humans as sort of like a safeguard. We know when something is unusual. So we're on our guard. So we either fight, we flight, we run away, or if the fear is just too debilitating, it can lead to fainting. But that's part of the fear cascade, which is normal, which I'll explain further. But the whole purpose of exposure therapy is to help the clients understand that some of their fears, though very real to them, are irrational because they pose no real threat to them. A lot of the clients and people who suffer from phobias or maybe social anxiety disorder are so afraid of encountering these situations that they completely avoid situations where they imagine their fears